Hi everyone, so this is the second part of the video of the SARS CoV-2 and the COVID-19. If you haven't watched the first part, I invite you to as a follow-up, as this video is a follow-up on that. The first part I discussed the physiopathology of the COVID-19, the early symptoms and sometimes the only symptoms that the majority of patients are experiencing, but also some of the possible complications of this COVID-19 that fortunately only a small percentage of patients are experiencing. I also described some of the physiology of the respiratory tract, because it's important, as it's an entrance door for this new coronavirus too. The second part of the video is I'm going to explore more of the physiopathology, more of the inflammation, and something called cytokine storm and the consequences of this. Also going to talk about the medication that already exists in the market. Since the vaccines and antibody therapeutics, it's going to take a while. There are some medication in the market that are being used for rheumatic diseases and antiviral medication that are producing some positive results in the fighting off the virus and the COVID-19. Also going to explore what is the evidence and the basic solid evidence of the vitamin D in its relation with the stimuli of the immune system, stimulating the immune system. There are some robust evidence, and especially in the respiratory diseases, not specifically for COVID-19, but in respiratory diseases. Going to explore finally the topic that was and is controversial that started a month ago, and some authors, some doctors, some researchers advised against the use of anti-inflammatory drugs and the danger of some of the anti-hypertension drugs that patients are taking for hypertension, and the link, the relation between taking those medication with a worse prognosis in COVID-19. So there's no consensus. Like I said, it's controversial, but I'm going to explore what is that all about, what is the action of anti-inflammatory drugs, anti-hypertension drugs, and what is the hypothetical reasoning that some authors and some researchers were alarmed by. So we're going to talk about that. Let's start the video. So part 2 of the severe respiratory syndrome caused by the new coronavirus and the disease caused by this virus called the COVID-19. You heard me to some extent talk about the angiotensin converting enzyme 2, Angiotensin II, but I didn't really explore what is that. What are those enzymes and hormones? What is this ACE2 enzyme through which the virus goes inside a cell, the pneumocyte 2 cell, if you remember? When we talk about angiotensin and angiotensin converting enzyme, we think immediately of blood pressure regulation. However, it's not the only functions of these enzymes and hormones. But let's first understand one of the main functions related with this angiotensin II and ACE, angiotensin converting enzyme. Let's review, and it all starts in the kidney. The kidney produces an enzyme called renin. Renin will convert another substance that is being produced in the liver in the bloodstream. Renin will convert angiotensinogen produced in the liver, will convert angiotensinogen into angiotensin 1. Angiotensin 1 will travel through the bloodstream and will be converted in angiotensin 2 by a ACE, meaning angiotensin converting enzyme. Whereas this enzyme is present in the alveoli, in the capillary, in the alveoli, so in the lungs. It's present in the heart, intestines, kidney, blood vessels, and the brain in less extent. What's the purpose of this angiotensin II, and why is this ACE in the lungs, heart, etc.? Because it's related, this AT2, it's related, intimately related with the blood circulation and with the pulmonary circulation and with the systemic circulation. So one of the main functions of the AT2 is the regulation of blood pressure, specifically the increase of blood pressure. How does it increase the blood pressure? Through this system called the renin-angiotensin-aldosterone system. The angiotensin, which is this system that I'm describing, angiotensin II, once converted here, will stimulate special receptors, angiotensin receptors 1 and 2, that are present in the hypothalamus, and will stimulate the hypothalamus and the pituitary gland. The hypothalamus that through the pituitary gland will produce release into the bloodstream ADH, or antidiuretic hormone, also called vasopressin. And I'll tell you why in a minute. Also stimulating the hypothalamus thirst centers, thirst nuclei that will increase the patient's thirst. In many ways, one of the ways is to decrease saliva. So I will experience a dry mouth and will experience thirst. AT2 will also go into the stimuli adrenal glands in the adrenal cortex to produce aldosterone. These two hormones will act in the kidney. So this is a nephron. And in the kidney, they will stimulate sodium and potassium pumps and will stimulate distal tubes to release into the bloodstream more water, more sodium, more chloride. Also, angiotensin II has the same function here. What is the purpose? The purpose is to increase blood volume by increasing sodium, water, and chloride. Another function of AT2 is to cause vasoconstriction, constriction of blood vessels. So why blood volume? Why the increase of blood volume? Why the vasoconstriction? And why does it interfere with blood pressure? Increases blood pressure because blood pressure is the cardiac depth multiplied by the total peripheral resistance. So if there's a vasoconstriction, the blood will have more resistance in the passing through the blood vessels. The space is more narrow, so the blood will find more resistance in the blood vessel's wall. It will exert more pressure. So if there's more resistance, more total peripheral resistance, if the total peripheral resistance increases by the vasoconstriction, it increases the blood pressure. What is cardiac depth? Cardiac depth is the systolic volume multiplied by the heart rate. So if there's more blood volume here, remember the function is here, the action is here, more sodium, more water, more chloride into the systemic blood circulation, there's more blood volume. If there's more blood volume reaching into the heart, so the heart has to pump more blood. So this pumping of more blood it's increasing the systolic volume, the ventricular contraction of blood. Meaning the systolic volume. Increase the ventricular contraction because there's more blood flowing into the heart, meaning that increases blood systolic volume. If the heart has more blood reaching into the heart, so it needs to pump faster, so it also increases heart rate. So increasing systolic volume, increasing heart rate will increase cardiac depth, that will increase blood pressure. So this is the function of the purpose of this system. It's not the only system that acts on blood pressure regulation, also autonomic nervous system can act. And if we have a system that increases blood pressure, of course we need to have counterparts, countermeasures that will decrease blood pressure in case of the blood pressure is too high. I'm not going to go into the causes of high blood pressure or low blood pressure. They can be physiological, just like getting out of bed really quick and standing up quick, and you can experience some of this drop of blood pressure. But high blood pressure or low blood pressure can also be pathologic from the heart, cardiovascular causes, or other diseases, from thyroid to a number of diseases that can cause pathological low or increase of blood pressure. I'm not going to go into that, but there's, of course, if the blood pressure is too high, we have another enzyme called ACE2, angiotensin converting enzyme 2, that exists in the same regions that the angiotensin converting enzyme, meaning it exists in the alveoli, exists in the heart, kidney, etc. And this one, what it does is whenever there's high quantities of AT2, ACE2 will convert AT2 into angiotensin 1 through 7. One of the functions of AT1, for instance, is to cause vasodilation. Again, if the blood vessel has a bigger diameter, increased diameter, in opposition of a decreased diameter, vasoconstriction. So if there's more vasodilation, meaning there's less resistance, less pressure, the blood exerts less pressure in the blood vessel's walls, and less resistance. If there's less resistance, lowers the blood pressure. This is one of the countermeasures that of the AT1 angiotensin 1 that it was converted from the AT2 by this specific enzyme. Why is this important? Because the coronavirus goes actually inside a cell through this AC2, this ACE2, if you remember. However, these are not the only functions of the angiotensin and the angiotensin converting enzyme. They have important functions in the blood pressure, but they also have important functions in immune modulation, has immune modulators in stimulating or inhibiting the immune system. So for instance, AT2, besides blood pressure, increase of blood pressure, is also a powerful pro-inflammatory mediator, pro-inflammation mediator. Why? How? Because remember, angiotensin is going to stimulate, it's going to connect to special receptors, angiotensin receptor 1 and receptor 2, in some of the organs I talked about before. But also, these receptors are also found in white blood cells, like macrophages, like monocytes. So when these macrophages are stimulated by the stimulation of these receptors by the AT2, they start to produce more tumeric growth factor, more prostaglandins, more reactive C protein, more vasoendothelial growth factor. These are called cytokines. These are called pro-inflammatory substances. Very important in the pro-inflammation phase of the inflammation. You know, inflammation has two phases: anti-inflammation, inflammatory, pro-inflammatory. These cytokines are very important for the inflammatory, pro-inflammatory phase. ACE, angiotensin converting enzyme, also exists in white blood cells. It can act independently of AT2 and also acts as a modulation of macrophages and neutrophils, white blood cells, including the stimulation and the increased expression of a major histocompatibility complex existing in macrophages, which is very important in the identification and in the killing of pathogen agents. ACE2, the entrance door for the virus. also acts as immunomodulation. How? Do you remember this is a counterpart of the blood pressure rise? It can lower the blood pressure. It can do the same thing in the immune system, meaning it can modulate the activity of these two. It can inhibit some of the functions that these two cause. Why? Because we don't want an overprotective, an overreactive, a hyperinflammation happening in the system, in the body, because that can be harmful as well. So we have this enzyme that kind of modulates the activity of these two. And what we're seeing in patients with COVID-19, the complicated ones, is because the ACE2, the entrance door for the virus, is also destroyed in the process that the virus goes inside the cell. Some of the immune modulation factors are not as active or as present because of the destruction of this enzyme. So to further understand the consequences of the virus and some of these complicated patients, let's review quickly what is infection, what is inflammation, how does the immune system act in the presence of any pathogen, meaning virus, bacteria, or fungi. So let's imagine this is a coronavirus 2, and if you remember the first part of the video, the coronavirus 2 goes inside some cells called pneumocytes 2. It goes inside the cell by this converting enzyme, angiotensin converting enzyme 2, ACE2, goes inside the cell, replicates itself, and finds a new cell, infects the cell, replicates itself again, and so on. So what does the immune system do? Well, remember in the alveoli we had different types of cells. Pneumocytes type 1, pneumocytes type 2, there's a U missing here, macrophages. So macrophages and also the infected cell start releasing into the bloodstream cytokines, meaning pro-inflammatory substances. Cytokines can be tumeric growth factor, vasooendothelial growth factor, interleukines, different types of interleukines. And some of these interleukines act as a pyrogenic agent, causing pyrexia. What is that? Fever. Interleukin 7 and 8 travel to the hypothalamus and stimulate the hypothalamus to produce prostaglandins that will eventually stimulate the thermoregulators in the hypothalamus, thermal regulators nuclei in the hypothalamus to increase body temperature, to cause pyrexia, to cause a temperature of the body above 37, fever. What's the purpose of the fever? Well, two actually. Number one, virus, bacteria, etc. don't like high temperatures. They kind of replicate better in lower temperatures. And this depends on the virus, etc. But in generalizing, it's like this. Another purpose of the fever is the immune system works better. The metabolic functions and actions of the immune system, of the white blood cells, etc., work better in high temperature. So the high temperature, it's caused by the increased activity of the immune system and the increased metabolic activity, which functions better and is more dynamic, is more interconnected, interrelated, stimulated if the body temperature is above 37 degrees, if it's experiencing pyrexia. The more fever you have, the more active your immune system is. Other substances are called interferons that these macrophages are producing. Interferons, as the name says, interfere in the immune response and interfere with the replication of virus, and they're produced by macrophages, fibroblasts, etc. The interferons will attach to the cell membrane. Once attached to the cell membrane, they will actually look for healthy cells, not infected cells, healthy cells. And they will look for healthy cells and attach to the cell membrane. Once they do attach to the cell membrane, and they'll release inside the cell and outside the cell and enzymes called antiviral enzymes. They will also inside the cell inhibit the protein synthesis. They will act on the organelles of the cells to decrease the production of proteins. So what for? What is these two things are here for? Well, once the healthy cells with these interferons on the cell membrane will go and look for the virus. In this case, they will surround the virus and start bombarding the virus, attack the virus with antiviral enzymes. Even if the virus can find a cell and go inside these cells, if the cell is receptive, because some of these enzymes diminish the protein synthesis, the virus cannot replicate itself, or it's harder to replicate itself. Remember, the virus goes inside the cell to what? To act on the genes related with the RNA to produce new RNA strains and to produce new proteins. The virus is composed by RNA and proteins. So if there's less protein, there's no protein, the factory is shut, then no replication. And on top of it, they're being attacked, the virus, by antiviral enzymes. This is one of the aspects, one of the mechanisms that the immune system uses against pathogen agents. Another mechanism is by the macrophages. The macrophages, specific macrophages called APC, antigens presenting cells, specific macrophages, they go and find the virus, and just like a Pac-Man, they start gobbling up, eating the virus. How do they do that? They extend their cell membrane, and they surround the cell membrane around the virus. So this is some viruses here, the red dots, and the cell membrane, it's going to goggle up, it's going to eat the virus. It's going to bring the virus inside the macrophage. So it's extending the cell membranes until the virus is actually inside the macrophage, or it's surrounded by the macrophage cell membrane, but already inside, and eventually the virus will go inside the cell. The virus, it cannot attack the cell because it's surrounded by a membrane. So this virus, although it's inside the macrophage, it's surrounded by a membrane. The membrane is called phagosome. So the macrophage, once the virus is inside the phagosome, the macrophage will start eating the virus through some enzymes called lysosomes. So this is exactly the same process than before, the one previous to this, only though it's inside the cell. So the lysosome will eventually break down the virus. Break down the virus into small particles, into small proteins. Viruses are made of proteins, sugars, glycoproteins, etc. Breaks down the virus into small proteins. Why is this macrophage so specific and has a specific name called antigens presenting cells? Because these macrophages, once the virus is broken down, the macrophage will present outside the cell membrane peptides, proteins that are produced in something called the major histocompatibility complex. So this macrophage has a capacity through this major histocompatibility complex. There's a specificity in some chromosomes of the macrophage that produce specific proteins, specific peptides that are exactly the same shape as the proteins of the antigen. And this is very important because they are exactly the same shape of this antigen, and they present the antigen outside the cell membrane. What's the purpose of this? To call lymphocytes type T. Lymphocytes type T have on their cell membrane antibodies. Antibodies are immunoglobulins produced in the plasma who are the same shape of this antigen. What happens is they will lash onto the antigen and will replicate themselves. So they'll replicate themselves with the antibody in the cell membrane with the specific protein of the antigen, and they will go and find and destroy other virus and other antigens in the system. So like this, it's much easier to find the pathogen agent, in this case a virus, much easier to find it. It's much easier to call other white blood cells, this is a type of white blood cells, to destroy the virus. It's much easier to release the cytokines to destroy and interferons to destroy the virus. So like this, they have a copy and they have specific proteins for this specific virus that will help to destroy the virus. And so you can see that, of course, if you're exposed to a virus or a pathogen agent, the body naturally will produce antibodies that naturally will help the immune cells to fight the virus. Of course, this process takes weeks, days, months to happen. And as we know, the coronavirus too, we haven't been exposed to this virus. We have been exposed to a lot of coronavirus, but not this specific type. So the body didn't produce antibodies yet. We don't have any antibodies to fight off the virus. One of the possible medication the researchers are developing is actually taking some of the plasma of the infected patients that already developed infected and recovered patients that already developed antibodies, and they're trying to use those antibodies in some sort of therapeutics. So people who are infected by COVID and are experiencing severe symptoms, they could take medication with those specific antibodies already that would help the immune system to work and to function specifically and faster. Some of the major symptoms, the more aggravating symptoms, some of the complications we're seeing in COVID-19 is what the doctors think is a cytokine storm and a super antigen concept. Cytokine storm, meaning there's a lot of cytokines. It's a hyper-inflammation, hyper-immune response. Why? Because it can happen that some of these antigens, proteins, they can link not to a specific antibody, but to any antibody, meaning they can link to any lymphocyte, meaning they can cause non-specific replication of lymphocytes, meaning they can cause a massive inflammation storm, a massive number, thousands, millions of lymphocytes that will also produce cytokines and hyper immune response that will cause cytokine storm. Lots of productions of cytokines. Imagine a hyperinflammation. Imagine a super aggressive immune system that instead of producing only thousands of lymphocytes starts to produce millions and millions and millions. It's very metabolic demanding. It eventually, the cytokines can eventually cause the destruction of healthy cells. Any immune response, if it's too prolonged and if it's too massive, can eventually lead to the destruction of healthy cells. The action of lymphocytes, of fibroblasts, of macrophages can lead to that. We explored in the first part of the video that can, if the inflammation is too prolonged, it can lead to vasodilation. It can lead to decreased blood pressure. If all this cytokine action and lymphocytes and all this immune system, it's so metabolically challenged and demanding that causes a lot of cytotoxicity. Cytotoxicity comes with a lot of metabolic acids. It can lead to metabolic acidosis, along with a decrease of oxygen, we explore that in the first part. It can lead to less perfusion of organs, metabolic acidosis, organ failure, and eventually septicemia, oedema in the lungs, pneumonia, and even in more complicated cases can lead to death. One of the topics I would like to discuss is vitamin D. Vitamin D, we need to understand the importance of vitamin D, as we need to go back and understand that all cells have a vitamin D receptor called the VDR receptor. All cells, but especially in large numbers in the alveoli, in the lung parenchyma, we have the epithelial cells have VDR receptors and other receptors called 25-hydroxylases D1 alpha. What this means is this receptor, once stimulated by the vitamin D, you know that vitamin D, we all know, if we sunlight, UV light, and through some foods like fat fish, and some foods can actually stimulate, or not stimulate, we can intake vitamin D through either UV light or the consumption of some foods. Vitamin D is very much related with the levels of calcium and phosphorus in the circulation, the blood circulation, and inside the bones. Why? Because the vitamin D stimulates liver, kidney, intestines for a reabsorption in case of the calcium levels are too low in the bloodstream, reabsorption in the intestine, and reabsorption in the kidneys to be released calcium, more calcium to be released in the bloodstream, for instance. But also in the bones, more calcium, more phosphorus go to the bone, non-mineralized bone, stimulate osteoclasts to actually mineralize bone that has not yet been mineralized by depositing more calcium and more phosphorus. This is a function of the vitamin D that is very well understood and known, but there's other functions. Other functions means through this VDR receptor that is stimulated by the vitamin D in the body, through sun, UV light, some foods, stimulate this VDR, and that's why taking vitamin D and low vitamin D can be so harmful for the immune system, because these VDR receptors can activate through this vitamin D the expression up to 2,000 genes. And now imagine they're present in all cells. So the expression of genes in the cells are also very much linked and dependent on the vitamin D intake. And we see patients with low vitamin D, they can experience fatigue, myalgia, meaning muscle ache. They can experience. It could be related to autoimmune disease, could be related with dementia, could be related with depression, cardiovascular diseases, infection diseases, eczema, respiratory diseases. And vitamin D has gained a lot of interest from both endocrinologists, dermatologists, pneumatologists, general practitioners, because of its importance. And so vitamin D can actually, the VDR receptors are present in macrophages, are present in Th1 and Th2, which are helpers of the lymphocytes. They are present in lymphocytes type 2, so again, they can stimulate the immune system and modulate the immune system. They can inhibit cytokines and interferons. Remember, these are very important pro-inflammatory substances. They can inhibit inflammation in this sense. They can decrease the cytotoxicity effects of lymphocytes T and B. In case of cytotoxicity, inflammation, they can attenuate these effects. They can promote the production of cathelicidin, What is cathelicidin is a protein, antimicrobian protein, that kills virus, bacteria, and fungi. So you see, vitamin D is crucial for the modulation and of the immune system and the immune response and the inflammation. It gained a lot of interest, as I was saying, and especially with these two studies that came out. This first one is a meta-analysis and a review. It's a review and meta-analysis of the vitamin D in the acute respiratory syndromes and respiratory diseases, and so it's in the high in the pyramid of evidence. It's in the top. This type of study compared more than 1,000 subjects, more than 1,000 patients, and concludes of the importance. The conclusion is that actually vitamin D is important in the stimulation of the immune system and the modulation of the immune system, diminishing infection and inflammation, especially in the respiratory tract. Another study, another review previous than this one, it also concludes that more studies are necessary, but concludes that vitamin D plays a major role. And this study finally led to the first one, which unequivocally explains and considers and the benefits of vitamin D. And as I said, there's not still a consensus of what is the ideal doses of vitamin D, but there is a consensus in all sorts of medical specialties, from endocrinology to dermatology to pneumology, of the importance of internal medicine, of the importance of the intake and a good amount of vitamin D in the body. Okay, so another topic I said I would discuss is what are the current medication in the market that are being currently used with some positive results. Well, I would say probably the most famous ones, most probably because of or somehow, I'm sure the White House and the coronavirus task force and the President Donald Trump are contributing to for the public awareness of something called chloroquine and hydroxychloroquine. They're investing a lot in this, and because chloroquine and hydroxychloroquine, which are drugs used for rheumatic diseases like lupus and rheumatoid arthritis and malaria, are showing some good results in patients with COVID-19. They can be also toxic. So again, it's difficult to find 100% consensus in medical doctors and researchers, but it's one of the drugs that has some good results. Other drugs are antiviral drugs. So what the effects on the COVID-19 patients, as I said, they're still under study, preliminary studies. The advantage of these drugs is that they already exist in the market, so that they don't have to go through years and years of research and application and study. But basically, how do they affect the coronavirus and the evolution of COVID-19? Well, the antivirals, for instance, they can block some of the antivirals. They can block the entrance door for the COVID-19, for the coronavirus too. Sorry. So this is a coronavirus, and it goes in the pneumocyte type 2 through this ACE2. So they can block the ACE2, meaning the coronavirus cannot go in, for instance. That's one of the effects of the antiviral. The other of this chloroquine, for instance, is the inhibition of gene-related with RNA, meaning the virus cannot replicate the single-strand RNA through the nuclei Remember, this is one of the mechanisms that the virus uses for the replication. So inhibition of this gene is related with the RNA. Other antivirals can inhibit proteases, meaning the virus it can't replicate because it can't produce new proteins that constitute the virus. So these are three main functions of these medications that are being used in the market so far. As vaccines will take a while, and also antibody therapeutics, these are showing some promising results. But again, what they feel is it's very early still to make some definite conclusions. And finally, I'm going to finish on the topic that I finished the first part of the video, which is to take or not to take anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, antihypertensive drugs for hypertension, and what was the cause of some controversial between doctors and researchers and etc. Specifically, an article that came out maybe a month ago that specifically talked about hypertensive drugs and ibuprofen, and making this parallel between a worse prognosis in COVID-19 and the intake of these drugs. Antihypertensive drugs are called antagonists of AT2 receptors, meaning they block the receptor of angiotensin II, meaning the angiotensin II can, do you remember, angiotensin II increases the blood pressure. So if this patient has hypertension, blocking the receptors for AT2, it means that it decreases blood pressure. Inhibition of ACE, angiotensin converting enzyme. You remember angiotensin converting enzyme converts angiotensin I into 2, and this one will cause the blood pressure to rise. So if we inhibit ACE, we will inhibit the production or the conversion of AT1 into AT2. Therefore, we decrease the hypertension. So that's the main function of this antihypertensives. What does anti-inflammatory drugs and antihypertensives have to do with COVID-19? That's the key. Well, hypothetically, effects of non-steroidal anti-inflammatory drugs in the COVID-19 that can have detrimental effects, hypothetical detrimental effects could be, well, number one, they lower the fever, especially ibuprofen. Lowering the fever, inhibiting the interleukin and the prostaglandins. If you remember also that the fever has a major importance role in the immune system. It helps the immune system to work better. The viruses are more uncomfortable in higher temperatures, so diminishing the fever is also diminishing the immune response, lowering the immune response. That can be detrimental. Unless the fever is very, very high, it can be harmful. Non-steroidal anti-inflammatory drugs like ibuprofen also inhibit something called COX-2. I'm not going to go too much into that, but it has to do with phospholipids in the cell membrane and phospholipase that in the inflammation phase, pro-inflammation phase, produce leukotrienes, prostaglandins, COX-2, and it's a substance important in the pro-inflammation phase, and that's why the drugs, anti-inflammatory drugs, cause an inhibition of this guy. It's not the only one, but they also cause. Do you remember ACE and AT2 had an important role in the pro-inflammation phase by stimulating white blood cells, and that will eventually produce more cytokines. So, if these two are involved in the pro-inflammatory phase, and if we're taking anti-inflammatory phase, they inhibit the activity of these two. The hypothesis is that if they inhibit the activity of ACE and AT2, maybe there is an increased volume, an increased expression, a overstimulation of ACE2, because ACE2 is the antagonist of this one. If this one is inhibited, then its antagonist maybe is expressed in more quantity, stimulated and in more quantity. So that's the I'm gonna explain this to keys in just after, so you can understand better. So, but that's one of the hypothetical um, effects, is that by decreasing activity of ACE and AT2 because they're pro-inflammatory, increase the expression of ACE2. ACE2, as you remember, it's the entrance door for the coronavirus. It also decreases the activity of interferon 1, which acts in the pro-inflammation phase. So as you see, NSAIDs inhibit, by inhibiting all these receptors and all these activities, from ACE to AT2, inhibit the immune system, immune suppression. Inhibiting ACE and AT2 inhibits the immune system because they stimulate white blood cells as well. So the idea is to decrease the immune response, immune suppression, decrease the inflammation. And the intake of anti-inflammatory drugs can be detrimental. And there's actually a study that you are seeing that considers this, and it says the use of anti-inflammatory drugs is a double-edged sword, meaning if the patient is experiencing a cytokine storm and a hyperinflammation that is also detrimental and is potentially destructive for the system, maybe corticosteroid drugs, not non-steroidal drugs, because they decrease the activity of ACE and AT2, but corticoid drugs, because steroid drugs act differently than non-steroid drugs. I won't go into that more, but steroid drugs decreasing the inflammation could be potentially good in a patient experiencing hyperinflammation. But at the same time, we're decreasing inflammation, suppressing the immune system. We're also lowering our chances, our capacity for the immune system to fight the virus and the effects of the COVID-19. So by lowering the immune system, we can we can actually develop more activity, bacterial activity, or we have less capacity to fight off the virus. So it's a double-edged sword that, again, there's still not a lot of consensus, and still this is very hypothetical. Okay, the use or not use of anti-inflammatory drugs. Corticosteroid drugs like hydrocortisone, it's different because it acts differently, but still, it's a very fine balance between addressing, taking anti-inflammatory drugs, of course prescribed by the doctor, of course in the hospital, controlled. It's a fine balance, because it's a double-edged sword, because you lowering the immune response if the immune response is too hyper, but also lowering the fight capacity of the immune system. Finally, what do the antihypertensives for hypertension have to do with COVID-19? Well, the antihypertensives, if you remember, they inhibit ACE, they inhibit angiotensin receptor 1. If they inhibit ACE, they'll be less. If they inhibit ACE will not convert AT1 into angiotensin II. Angiotensin II increases blood pressure, if you remember. If antihypertensive drugs inhibit angiotensin receptor 1, angiotensin II cannot connect to the receptor. So it cannot cause vasoconstriction. It cannot cause an increase of blood volume. And that's why the drugs caused a decrease of blood pressure. So they're hypotensors. So, of course, not all hypertension drugs use the same mechanism. Some hypertension drugs block the calcium channels, for instance. And calcium is important in the muscle contraction, in the vasoconstriction, in the myocardial contraction. So not all drugs act the same way. But the ones that act as inhibitors of ACE and AT receptor 1, the hypothesis was it can lead to an increased number of ACE2. So you know that the cell is very much alive and very much interconnected with other cells and with its external environment. And the purpose of the cell is to produce enzymatic functions, metabolizing functions, to stimulate other cells, for instance, to stimulate other cells, or to produce such certain functions, let's say. So that means the cell, it's very much dependent on the stimuli of the outside, of the external environment. The external environment, it's in a perfect balance, in a perfect equilibrium, and some substances are going to interfere with the cell membrane that's going to cause the cell inside the cell to start acting in a certain way to produce certain things. So what happens with the cell is the purpose of the cell, one of the purpose of the cell is to be available to receive stimuli. If this angiotensin converting enzyme is being inhibited by these drugs, what does the cell think? The cell has on its membrane a bunch of enzymes, angiotensin converting enzyme and angiotensin converting enzyme 2, on its cell membrane. If one type of these enzymes is being inhibited by a drug, what the hypothetical reasoning is, well, if none of my enzymes, ACE, are being stimulated for some reason, then maybe I should increase the expression, I should increase the number of the other ones, the ACE2 enzymes, because those ones are fine. Nothing is blocking that stimuli. So maybe I'm going to increase more for my cell membrane to be perfectly capable of receiving any stimuli. The problem with this, if this actually happens, is that allows more coronavirus to go in more quantities and more. It increases the permeability and the receptivity of the cell because there is more entrance doors. This again is a hypothesis. Again, there isn't a consensus, but this was the hypothesis that led to a discussion in the past month about this topic. Some authors threw this out there based on some patients that got severe symptoms in China, Italy, etc., France, and so some doctors, including the World Health Organization, pronounced themselves a few weeks ago about maybe the potential danger of these drugs. However, the WHO 2 weeks ago, because again there's no consensus, 2 weeks ago pronounced again, saying that they weren't against the use of anti-inflammatory drugs. So again, this just shows that not a lot and is known about the COVID-19. I mean, I'm sure as scientists today, we know much more than we did 3 or 4 months ago. But there are some aspects of the disease and some of the interactions of the virus that are still unknown. There's information about the patient zero. There's information about the antibodies. There's a lot of also important aspects that we don't know, and also there's opinions that vary in different ways and in different fields and in different times, which is perfectly normal as a science, and especially when we encounter something that is absolutely new. Okay, so this is the end of the second part. I hope it was educational. I hope it was informative. Hopefully, it wasn't too long. And just as a final advice, this information that I just explored is merely informative, meaning I'm not a doctor, I'm not a nurse, as I said in the first part. Um, this is not at all any advice to take anything or not to take anything. It's merely an intellectual exercise that any questions, any fears should be questioned, should be through the questioning of doctors, and listening to the evidence, listening to the communication that is coming from legitimate research entities and communication agencies like the WHO. And depending on the country you live, I mean, in my country, I know more what are these agencies, but go through legit institutions and agencies, and never follow or think that this video is going to give any advice on how to act and how to follow. Be safe. We all know we have to use a mask now. Be safe, and hopefully we'll see you soon, as I'm thinking also to develop more videos about lots of topics. Thank you very much. See you soon.